Yes, I'm a GP in the Bromley by Bow Partnership, but I'm also chair of Tower Hamlets CCG. And I'm going to take you on a whistle-stop tour of the Bromley by Bow Centre, and then I'm going to hand over to Dan, who's going to talk to you about social prescribing or self-care prescribing. So just to go into the Bromley by Bow Centre, I think one of the key features of the Bromley by Bow Centre is it deals holistically with healthcare. You know, wearing my hat as chair of the CCG, I'm very aware that probably within the health service we deal with 15, max 20% of healthcare. Healthcare actually gets delivered in all sorts of other places and in other ways. But what we try and do at Bromley by Bow, with over 100 different projects going on under one roof on a 3-acre site, is actually address holistic healthcare of patients. So we deal with, yes, traditional healthcare within the NHS, but their housing, their employment, their environment and their education all at the same time. And if you don't do that, we think you're only actually beginning to address people's healthcare. And here you see the introduction slide just gives you a sense of some of those projects. As I said, a 3-acre park, known by my patients originally as Dog Shit Green. You can imagine a typical inner city park. But of course, the first thing we did was build on it. We built a health centre, we built an enterprise centre, and that's quite extraordinary in some ways because to get to build on any parks is almost impossible. But what that turned that space into is a healthy space. And of course, this is the entrance to the health centre. Notice no NHS signs, no Dr. Sam Everington surgery or anything like that. Ministers were very unhappy about that, but that's all about giving the message about self-care. This is yours. This is your centre. This is not the NHS, this is not the state, it's yours, it's part of the community. And of course, key to that is the welcome right at the beginning. And of course, when you come in to the front entrance, you have this beautiful area, a little pond with frogs jumping around. And immediately, of course, that is so important, isn't it, about the patient's journey, because anything you can do to get people to relax along the way is really important. And of course, here you see in the yard, this group actually, I always like to describe this as the Leghouse and Flower Arranging Clinic. That was just one of the projects set up by the district nurses. Of course, not really needed now, actually, because that problem's been solved. And of course, the key issue there wasn't magic medicine by us. It was actually about mobility and the bringing back the joy of life into patients. And of course, now they call themselves the Young at Art. Because they're busy doing a whole raft of other things within the centre. And of course, when you come into the waiting room, of course, it's an open, beautiful space, open reception, no bars, no windows or anything like that. Does that cause problems in terms of security? Absolutely not, entirely the opposite. But of course, at reception desk, you have reception for everything that goes on in the centre, including on the right-hand side, you will have the housing officer from the local housing trust, the Harker. And of course, key to all this actually is the whole way we behave. It's not a surprise that I don't wear a tie. We don't use titles. We go out to the waiting room to collect patients. And of course, see what you see here. Now, if I could do what you see in this picture in every surgery in this country, it would transform the relationship between doctors and patients. Because what we do is sit on a curved table next to each other with a computer screen in front. Just think of your experience in the olden days, actually, when I started as a GP. Of course, we wrote the prescriptions and ignored you. And then the latest version is tapping away on the computer and ignoring you. The way you sit, the way you relate, the way you dress, all these things are absolutely critical to the relationship, but critical to self-care. And of course, self-care has to be the future in a health service that is completely and utterly cash-strapped. As chair of the CCG, I've got to save £75 million in the next year. I'm very aware that not only does self-care make sense in terms of delivering health care, but it's the thing that probably is about the only thing that can save the health service. And of course, we have so many options for prescribing. Gardening on prescription, educational classes, this is English as second language. We have community care within the centre. We have a vegetarian restaurant. Here we are celebrating. We're a community university, so here we're celebrating people getting their degrees. And of course, actually, this all started from a church 25 years ago that said, actually, what do we need to do in this community? We're a dying church, we've got an elderly congregation, and of course, the first thing they came up with was a nursery. That's what the local community want. So this is a child space area during the week, and my 21-year-old and 19-year-old went there as nursery. They went to the after-school club. They left there when they were 14. You get the sense, probably, of that wider determinants of health, that you can only deliver true healthcare if you embrace all these things. And that is critical to healthcare. And I'll leave finally on an invitation, as we have an invitation anytime, to go on our website and book yourself in to come and have a much more wider and extensive tour than I've managed to give you. And now I'm going to hand over to Dan to focus very specifically on social prescribing, which is a very new project for us, and I think something you will increasingly hear across, being picked up across the nation. Dan.
Thank you, Sam. Okay. I'm going to talk, in a sense, about taking self-care, which we do a lot of at the Bromley by Bow Centre. So the things that you traditionally know as being around self-care, about groups of people who've got diabetes, who've got asthma, walking groups and so on. We've taken that on a little bit of a journey, really. And I think if you remember the photo of the centre, we have a GP practice there with about 7,500 patients. We also have a team of about 100 staff delivering community services at the Bromley by Bow Centre as well. And the whole premise of the Bromley by Bow Centre, if you like, is around the social determinants of health. It's the fact that there's a very limited amount of what a GP can do in a consulting room in terms of all the other aspects of somebody's life as well. And of course, all of us are, I'm sure, very well versed in the Marmot Review and the idea that actually a larger proportion, if you like, of health outcomes that people have over their life course that will both affect how healthily they live their life, also, of course, life expectancy as well, are considerably to do with things like the levels of skills people have, the levels of qualifications they have, whether they live in adequate housing, whether they're overcrowded, whether they have a job over which they have some control, whether they live in a neighbourhood where they have a degree of social capital and can call upon other people, whether they live in poverty or not and have the ability to eat healthily and keep their home adequately heated, which is an interesting issue at the moment, and so on. So these are all the things that will determine, to a much greater degree than anything else, the health outcomes that people will have. So how do you, if you're working in a community like Tower Hamlets, which has the fourth highest level of child poverty, for example, 20% of our local households have an income of less than £15,000 a year. 23% of our local adult community do not possess one single qualification at all. We have 50% higher unemployment in Tower Hamlets than we do as a London average. So you can just go on looking at those social indicators and think what they're doing to health. So if you're working in a health centre, the most logical thing that you're going to be doing is how do you improve those social determinants of health? Now, I think that it's very interesting thinking about who in our modern society has a lot of contact with people over a long period of time. By and large, we don't go to church anymore. We increasingly less go to the pub. Corner stores have disappeared, all but. The post office doesn't serve the same sort of function that it used to. So all those people, all those professionals and all those meeting points that we used to have where we could talk to people about things going on in our lives have largely disappeared. I think one of the most constant features in people's lives now is the relationship that they have with their general practitioner and the nurses within the GP partnership where they're registered as a patient. So I think that puts health professionals in a hugely strong position to think about people's lives, think about the more holistic aspects of people's lives, think about the recurrent issues that happen in people's lives, and also think about some of the really acute needs that people have as well. So I think that puts the health professionals in an ideal situation to prescribe for their patients access to a whole wide range of services that will deal with acute issues, but also acute issues, the sort of things I mean are things like debt crises, for example, people who are having terrible problems with welfare benefits, people who increasingly are being sanctioned by the DWP for minor issues to do with signing on to get their benefits and so on. So you need to get people to welfare benefits advice, you need to get people to financial capability support, people who are unemployed, for instance. So the most logical thing to do is get them to an organisation that's local, that supports people around their employability, work experience, work tasters, getting qualifications, building up their skills, building up their confidence, getting them to employment, for example. Tower Hamlets, we have a huge proportion of our community who have English as a second language. So that's an enormous barrier to health. It's an enormous barrier to accessing health information, for example. So getting people into English language classes, getting them to practice their English, and then working with the English language training providers to incorporate health as part of the content of English language classes is a logical solution to supporting people who don't speak English as a first language in terms of improving their health and so on. What we did was to create at the Bromley by Bow Centre, every time we got a new project, and Sam's just mentioned we have up to 100 projects, every time we got a new project, we'd invent a new referral form, and the poor GPs and nurses ended up having sort of 15, 20 referral forms. They never knew which one to use and which form was for which service, and some of the forms required huge amounts of information. About 2 years ago, we subsumed all of those referral forms into one very, very simple A4 sheet. It's embedded on everybody's computers, all the GPs' computers in their consulting rooms. It self-populates, the first section self-populates from EMIS, so you get the patient's details self-populating. Has one simple box, a little bit of background about the patient. The next box asks, what do you hope that this referral will do for the patient? And underneath there are a whole series of tick boxes about which service it is that you're referring that patient to. It could be welfare benefits advice, financial capability, adult skills, it could be a gardening group, it could be getting employment, it could be one of a whole range of projects. And the last box says, I don't know which service this patient should be coming to, but I need somebody to give them a ring to see what will help them. That goes to one single email address, which actually is danhopewell@nhs.net, which I've been given an honorary NHS email address. At that point, because it can't travel any further through NHS data systems, it gets printed out, so we get 2 copies of the referral form. One goes into a very high-tech lever arch file that keeps a cumulative record of all the referrals ever made, and the other goes into an extremely high-tech brown paper envelope and gets given to the team to whom that referral has been made. Through that process as well, there's somebody curating that email address, who isn't actually myself, who picks up the emails and quite often phones the patient up to check on the referral, make sure they're being referred to the right service, and helps to introduce them to the service that's going to get in touch with them to come into to whatever it is they've been referred to. This is generating, we ran this for about a year at the Bromley by Bow Centre between the GP practice and the services at the centre. With a CCG grant, we now have rolled this out to the neighbouring 4 GP practices. Lots of presentations to all the GP practice meetings, of course. You can't just give them a form on a computer. You need to go in and talk to the GPs and nurses and receptionists about what all those services are and what they can do for the patients. And you have to continually remind them of that. And we spend quite a lot of time loitering in waiting rooms, talking to patients as well, and reminding the reception staff about the social prescriber project. This is now generating 50 referrals a week from 5 GP practices, the Bromley by Bow GP practice plus 4 others. That's sort of about 200 a month, obviously. We've calculated the person who curates the emails and who makes the phone calls and makes the referrals is working 3 days a week. The whole thing effectively costs about £20,000 to £25,000 a year to run, which is 0.3% of the prescribing budget of those 5 GP practices, so it's a minimal cost. We reckon that it's running at between about 1,000 and 1,300 referrals, maybe even more now, because some are repeats, obviously, per year. If we, obviously there's an attrition rate, but we reckon that at least 60% of those referrals work their way through to actually contact to the group that's actually going to be seeing them. We reckon that if each one of those people who come through drops 1 appointment with a GP per year at £39 per GP appointment, which is what the King's Fund reckon they cost, the whole thing pays for itself quite simply. All the savings in prescribing and all the savings in more attendance at A&E and so on are just savings to the NHS. So the whole thing pays for itself very, very easily, and it's minimal cost. That's running against a patient list of about 33,000 patients across the 5 GP practices.
Just to add a final sentence, from the GP's perspective, of course, keep in mind it's a footfall to die for in terms of access to patients. In a practice like ours, we'll see 90% of our patients in a year. Think about the 10-minute consultation, though, and how you enable. I mean, I see 60 patients a day. The workload for most GPs now is completely overwhelming. Just think how great it is to have one click away, actually, this option for all patients. And of course, from the GP's perspective, suddenly there's an army of people out there to help you. In Tower Hamlets, 1,100 voluntary sector organisations. That's what we're potentially tapping into. And wearing my CCG hat as clinical chair, I plan to pan it out across the whole of Tower Hamlets, because I'm very clear that this is something that's going to save on my budget. The financial thing is the thing that's driving so much, but of course it's clinically delivering, it's health delivering for patients.
So thank you very much.